What conditions can be treated with bone marrow prolotherapy? It's the same conditions that normal prolotherapy could be used for. Traditionally, prolotherapy is used for ligament and tendon injuries. Any kind of ligament sprain, tendon sprain, degenerated tendon, degenerated ligament, torn tendon, torn ligament. But we're excited about bone marrow prolotherapy as it relates to articular cartilage injuries. There's folks that have degeneration of the articular cartilage, which typically is called chondromalacia, but there are, especially athletes or people who've had trauma that have articular cartilage lesions, like they'll get an arthroscopy and they'll have basically a part of the articular cartilage that's missing. Like a certain part of their knee, the articular cartilage looks good, but because they had a fall or they had a trauma, there's might be a 1 centimeter part of their articular cartilage that's missing. So traditionally what they've had done there is autologous chondrocyte implantation, which is ACI. In other words, they would go to a surgeon, he'd do an arthroscopy, he would take out some cartilage cells, they'd grow those cartilage cells for a certain specific amount of time. Then the athlete would have a second surgery where they would implant those cartilage cells right on the lesion. The problem is, if you look at the results of that, it doesn't work all that good. Like, what do we see at Caring Medical? I see all the failures of that. You know, I know that there are folks that helps, and I'm glad the orthopedic surgeons are out there, but I really have a strong feeling that people should try prolotherapy first. In other words, I feel like you should try, when you have a musculoskeletal injury, even a cartilage injury, that you should try prolotherapy first, and it should be the prolotherapist referring to the orthopedic surgeon, not that somebody should get, you know, 1, 2, 3 orthopedic surgeries, then we're seeing them. You know, so if a person's going to get, you know, a meniscus surgery, cartilage surgery, you know, ligament, tendon, you know, arthritis surgery, I really feel like they should first get an evaluation by a prolotherapy doctor, because if you look at the studies we've published, we have about a 90% success rate of helping people resolve their pain complaints with prolotherapy and them not needing the surgery. I mean, when we first did the analysis as far as meniscus tears and meniscus injuries, and whenever we do a study, typically we just hire somebody. We'll hire somebody to actually call the clients, you know, look through our charts, call the clients. So I don't know, like, you know, the results are going to be good, not good, because eventually, soon we're going to do labral tears. You know, almost every patient I see that gets a labral tear and they get prolotherapy, it gets resolved, but I don't know the specific numbers. So we'll just hire somebody like a college student or a pre-med student, you know, to look through our charts, you know, see the folks who came here for labral tears and call them with a specific questionnaire. Well, imagine our shock when we did this for MRI documented meniscal tears, and 27 of 28 patients, you know, basically resolved their pain complaints with prolotherapy, and only 1 out of 28 needed then to subsequently get surgery for a meniscal tear. I mean, imagine how this would revolutionize meniscus care. So if you got a meniscal tear, clearly you should try prolotherapy prior to getting a surgical procedure. As it relates to bone marrow prolotherapy specifically, a doctor like myself would use bone marrow generally only in severe cases, like severe cases of articular cartilage injury or severe degenerative arthritis, or if someone had already failed Hackett-Hemwall prolotherapy, or Hackett-Hemwall prolotherapy got them 50% better, and then you know, it seemed like they weren't getting any better, then we might switch to, you know, bone marrow prolotherapy. Let me just give you an example. I'm thinking of like a 44-year-old guy who's, you know, he's like 6'3", who's a client of ours, you know, has really significant degenerative arthritis of his right hip. You know, and a 44-year-old, he is a candidate for a hip replacement, but I mean, do you really want a 44-year-old getting a hip replacement? So he's strongly anti-hip replacement. He's very much into alternative medicine. So at his last visit, you know, he's had 8 visits, and he knew going in that it was going to be a year's worth of care. You know, and he's very happy. He's back to doing everything. You know, but there's still kind of some, hip discomfort there. So him and I at the last visit, we had talked about, we either are going to go to platelet-rich plasma prolotherapy or bone marrow prolotherapy. So, that would be the sort of case where, you would consider then going to bone marrow prolotherapy.